Hello, friends. Thyroid disorders. Any dysfunction of thyroid gland present in neck. Type: hypothyroidism, hyperthyroidism. Hypothyroidism. Thyroid gland not make enough thyroid hormones. Sign and symptoms: sensitive to cold, fatigue, weight gain, constipation. Dental management. Hypothyroidism patient can treat as a normal patient. Syncope may be seen in patient. Observe the clinical sign like enlarged salivary gland, etc. Hyperthyroidism. Thyroid gland make more hormones than body needed. Sign and symptoms: hyperangios, profuse sweating, warm to touch, palpitation. Dental management. Hyperthyroidism patient need to treat with extra precautions. Stress reduction protocol need to follow. Follow the automatic technique. Use plain LA without adrenaline. Don't use aspirin to relieve pain. Use anxiolytic. Hyperthyroid drug profile thiouracil (PTU) has anti-vitamin K property and can cause excessive bleeding. Before treating hyperthyroid patient, please take physician's consent. That's all about thyroid disorder and its management in dental hospital. Thanks for watching. Don't forget to like, share and subscribe the channel.